The monitor flatlined. Dr. Kira Vaughn's hands moved inside the open chest cavity, fingers slick with blood, compressing the heart manually while everyone else stood frozen. "Who taught you that technique?" Dr. Marcus Hale asked, his voice barely above a whisper. She didn't look up. Her hands kept moving, rhythmic, precise, like she was playing an instrument only she could hear. "Delta Force," she said. The room went silent. For stories like this, subscribe to Emergency Hero Stories. 48 hours earlier, the fluorescent lights in St. Catherine's Hospital burned too bright, made everything look sterile and cold, like the building itself didn't believe in warmth. Kira stood in the back of the orientation room, arms crossed, watching 12 other first-year residents fidget in their chairs. She'd chosen the last row on purpose. Old habit. Always know your exits. Dr. Marcus Hale stood at the podium, gray hair perfectly combed, white coat pressed like he'd never seen a real emergency. He had the kind of voice that expected to be obeyed, the kind that didn't ask questions because it already knew the answers. "Surgery is not a democracy," he said, scanning the room with the confidence of someone who'd never been wrong. "You follow protocol. You follow hierarchy. You do not improvise." Kira's jaw tightened, but she said nothing. Hale continued. "Some of you come from impressive programs. Some of you don't. It doesn't matter. Here, you start from zero." His eyes landed on her for half a second, then moved on. She'd expected that. Her file was thin. No prestigious residency, no Ivy League medical school name to impress anyone. Just a basic MD and a stack of certifications that didn't mention where she'd really learned to cut. After the presentation, they were assigned to shadow senior attendings. Kira got Dr. Hale, of course. The appendectomy was supposed to be simple. Observe and learn. Don't touch unless invited. The patient was a 17-year-old girl named Macy, blonde hair pulled into a braid, scared but trying not to show it. Kira stood in the corner of the OR, hands behind her back, watching Hale make the first incision. His technique was textbook. Slow, methodical, safe. Kira's fingers twitched. She'd done this surgery in 12 minutes once, in a field hospital outside Kandahar. With mortars shaking dust from the ceiling and no anesthesiologist because he was working on someone else. Hale glanced at her. "Dr. Vaughn, come closer." She stepped forward. He gestured toward the suture tray. "Show me a simple interrupted stitch." It was a test, the kind designed to humble first years. Kira picked up the needle driver, threaded the suture without looking, and made 3 stitches in the practice pad on the side table, each one identical, perfectly spaced. Faster than most attendings could manage. Hale paused mid-cut. The scrub nurse, a woman in her 50s named Gina, tilted her head slightly. "Where did you train again?" Hale asked. "Here and there," Kira said. "That's not an answer. It's the one I have." His eyes narrowed, but he didn't push. Not yet. They finished the surgery without incident. Macy would recover fine. Hale stripped off his gloves and left without another word. Gina stayed behind, cleaning instruments. "Those sutures," she said quietly. "That's not normal resident work." Kira didn't respond. "I've been in ORs for 30 years. I've seen a lot of techniques. Yours is different. I study hard." Gina smiled, but it wasn't unkind. "Sure you do." Later, in the resident lounge, Kira sat alone with a cup of coffee that had gone cold an hour ago. The room smelled like old takeout and exhaustion. The door opened. A nurse walked in, younger than Gina, maybe mid-20s, with dark eyes and an easy smile. His name tag read Dante Ruiz. "You're the new resident, right?" he asked. "One of them. Heard you impressed Gina. She doesn't impress easy." Kira shrugged. Dante grabbed a soda from the fridge and leaned against the counter. "So where'd you come from? What program? Does it matter?" "Guess not." He popped the can open. "Just making conversation. This place can be rough if you don't have friends." She looked at him for a moment, weighing whether to engage. He seemed genuine, not performing, just tired like everyone else. "I'll keep that in mind," she said. He grinned. "That's almost friendly. Progress." As he turned to leave, her hair shifted, and he caught a glimpse of the small tattoo behind her right ear, a tactical cross, faded but unmistakable. "That's a cool tattoo," he said. "What's it mean?" Kira's hand moved instinctively to cover it. "Old travel mistake. Looks deliberate to me. Most mistakes are." Dante studied her for a second, then nodded. "Fair enough." He left. Kira exhaled slowly, pulled her hair back down, and finished the cold coffee in one swallow. Her pager buzzed. Routine labs needed review. Nothing urgent. She stood, tossed the cup in the trash, and headed back into the fluorescent hallway where everything was too bright and nothing was what it seemed. If you want to see what happens when everyone underestimates the quiet one, make sure you subscribe to Emergency Hero Stories, because what she does in the next few minutes will leave you speechless. Where are you watching from? Drop a comment below. The residents' locker room smelled like disinfectant and nervous sweat. 3 first-years sat on the benches, still in scrubs, voices low but not quiet enough. Did you see her sutures today? The speaker was a guy named Ben, tall and pale with circles under his eyes. Like she's done 1,000 of them. Probably has, said another resident, a woman named Ashley, with red hair tied back tight. She's older than most of us. Maybe she worked as a PA or something before med school. No way. PAs don't move like that. She's too fast. Lucky guess, Ashley said. Or she's been watching surgical videos all night. Ben shook his head. Nobody learns to suture like that from videos. The third resident, a quiet guy named Patel, hadn't said anything. He just laced up his shoes and stood. Maybe she's just good. Ashley snorted. Or maybe she's hiding something. Kira walked past the half-open door, heard every word, and kept moving. She'd heard worse. The gallbladder case came in at 11:30 that night. Routine cholecystectomy. Textbook simple. The kind of surgery they let first-years observe because there's not much that can go wrong. Dr. Hale assigned it to her with a wave of his hand, like he was bored just thinking about it. Straightforward lap chole, he said, not looking up from his tablet. Patient stable. Vitals are fine. Should take you 90 minutes if you don't overthink it. Understood, Kira said. Try not to make me regret giving you OR time. She didn't respond. The patient was a 52-year-old man named Carl Brennan, insurance adjuster. Complained of right upper quadrant pain for 3 weeks. Ultrasound showed gallstones. Classic presentation. Kira reviewed his chart in the pre-op bay. Vitals were stable, but something felt off. His white blood cell count was elevated. More than it should be for uncomplicated cholelithiasis. His liver enzymes were also climbing. She flipped back through his notes. The pain had started 3 weeks ago, but it had worsened sharply 2 days ago. He'd been nauseated, feverish. She walked back to his bedside. Carl was awake, groggy from the pre-med, but coherent. Mr. Brennan, she said quietly, how's your pain right now? Bad, he muttered. But they gave me something. Is it sharp or dull? Sharp, like someone's stabbing me. Does it move? Radiate anywhere? He thought about it. Yeah, goes to my back sometimes, and my shoulder. Kira's jaw tightened. Referred pain to the shoulder. That wasn't just gallstones. She pulled up his imaging again on the computer. The ultrasound was clean, but it only showed the gallbladder. It didn't show the surrounding structures clearly. She paged Dr. Hale. He arrived 10 minutes later, irritated. What is it, Vaughn? I think we need a CT before we go in. He frowned. Why? The ultrasound is clear. Gallstones, classic symptoms. His white count is too high. Liver enzymes are climbing, and he's got referred pain to the shoulder. I think this might be a perforated ulcer, not just cholecystitis. Hale stared at her. His vitals are stable. Pain is consistent with gallbladder disease. You're overthinking. I'm not. You've been here 6 weeks, Dr. Vaughn. I've been doing this for 28 years. We're going in as planned. She held his gaze. Then let me order the CT on my own authority. You don't have that authority. Then give it to me. He exhaled sharply, glanced at the nurse, then back at Kira. For a moment, he looked like he might shut her down completely. Instead, he pulled out his phone and checked the time. Fine, he said, order the CT. But if it's clean, you're wasting everyone's time, and I'll remember that. Understood. The scan took 40 minutes. Carl was moved to radiology, prepped, scanned, and brought back while Kira stood outside the imaging suite, with her arms crossed, watching the clock. When the results came back, Hale opened them on the shared monitor without a word. The CT showed a perforated duodenal ulcer, contained but leaking. If they'd gone in laparoscopically for a routine gallbladder removal, they would have missed it until it was too late. Hale stared at the screen. The radiologist's note was clear. Recommend open exploration and repair. Kira said nothing. Hale turned to her. His expression was unreadable. Not angry, not impressed, something in between. Lucky catch, he said. It wasn't luck. He closed the imaging window. We'll take him to OR2. Open procedure. I'll lead. You'll assist. Yes, sir. As he walked away, Dante appeared from around the corner, pushing a supply cart. He'd been standing there long enough to hear. That was ballsy, he said quietly. Kira didn't look at him. It was necessary. Most first years wouldn't have pushed. Most first years haven't seen what happens when you don't. Dante paused, studying her. Where did you see that? She finally met his eyes. Somewhere else. He nodded slowly, like he was piecing something together, but didn't want to say it out loud yet. The surgery took 3 hours. Carl Brennan survived with 0 complications. Hale repaired the perforation, reinforced the duodenal wall, and placed a drain. Kira assisted without a single mistake. When it was over, Hale stripped off his gloves and looked at her across the table. You were right, he said. Yes, sir. Don't let it go to your head. She almost smiled. Almost. Later, back in the locker room, Ashley and Ben were talking again. She got lucky, Ashley said. Hale wouldn't have ordered that scan if she wasn't so pushy. Maybe, Ben said. But she was right. Doesn't mean she's better than the rest of us. Patel looked up from his locker. Doesn't mean she's not. Kira walked past them again, this time meeting Ashley's eyes for just a second. Ashley looked away first. It was 11:47 p.m. when Kira finally sat down in the break room with another cup of bad coffee. Her shift wasn't over. She had 4 more hours. Dante walked in, saw her, and sat down across from her without asking. You don't talk much, he said. No. But you see a lot. She looked at him. What do you want, Dante? Just trying to figure you out. Don't. He grinned. Too late. She took a sip of coffee, said nothing. That tattoo, he said. The one behind your ear. I looked it up. Her hand didn't move, but her eyes sharpened. It's a tactical cross, he continued. Military medics wear them. Special operations, usually. Kira set the cup down slowly. You should stop guessing. I'm not guessing. She stood. My shift's not done. As she walked out, Dante called after her. For what it's worth, I don't care where you came from. I just think you're wasting time, pretending to be something you're not. She didn't turn around, but she heard him. The call came in at 2:14 a.m. Motorcycle versus SUV. High-speed impact. Rider down. Unresponsive at scene. Intubated by paramedics. ETA, 4 minutes. Kira was in the ER when the radio crackled. She'd been suturing a laceration on a construction worker's arm. Slow and methodical, letting the attending watch her technique. Dr. Priya Anderson stood nearby, arms crossed, observing without comment. She was the ER director, 41 years old, former Army nurse before she went to medical school. She didn't talk much about that part of her life, but Kira had noticed the way she carried herself. Shoulders back, eyes always scanning. Military posture doesn't fade. The paramedics burst through the doors, pushing a gurney at full speed. A man in his mid-20s, leather jacket shredded, helmet still on, chest rising and falling with the ventilator bag. Pneumothorax, left side, the lead paramedic shouted. Breath sounds absent, possible aortic injury, BP dropping fast, 80/50. Dr. Hale appeared from the hallway, still pulling on gloves. Get him to trauma 1, someone page cardiothoracic. Kira stepped forward. I can handle the pneumothorax. Hale didn't even look at her. You can observe. Sir, if his pressure keeps dropping. I said observe, Dr. Vaughn. She stepped back. They wheeled the patient into trauma 1. The room smelled like gasoline and blood. Kira followed. Staying near the wall, hands behind her back. Hale cut away the jacket. The rider's chest was bruised, dark purple spreading across the left side. His ribs looked wrong, uneven, like something had shifted underneath. Tension pneumothorax, Hale said. We need to decompress now. He reached for the needle, but his hands fumbled with the packaging. He was tired, 16-hour shift. His fingers weren't moving as fast as they should. Kira's jaw tightened. The monitor beeped. Blood pressure, 70/40. Hale finally got the needle free, positioned it over the second intercostal space, but hesitated for half a second, recalculating the angle. That half second was too long. Kira moved. She crossed the room in 3 steps, took a 14-gauge angiocath from the tray, didn't ask permission, and placed it at the second intercostal space, mid-clavicular line, left side. What are you? Hale started. She inserted the needle in one smooth motion. There was a hiss of air, sharp and immediate, as pressure released from the chest cavity. The patient's oxygen saturation jumped from 82 to 91 in 10 seconds. The monitor stabilized. Hale stared at her. So did everyone else. Kira pulled the needle, secured the catheter, and stepped back. Her hands were steady. No tremor, no hesitation. "Decompressed," she said quietly. "He needs a chest tube next." Hale's face was unreadable, somewhere between anger and disbelief. Dr. Anderson spoke from the doorway. "She's right. Get the tube kit." Dante handed Kira the tray without being asked. She didn't look at him, just opened it and laid out the instruments in the order she'd need them. Hale finally moved. "I'll place the tube." "With respect, sir, I'm faster." "Dr. Vaughn, he's got maybe 3 minutes before that lung collapses again. You're tired. I'm not." The room went quiet. Anderson stepped closer. "Let her do it, Marcus." Hale looked at Anderson, then back at Kira. His pride was fighting his logic, and logic was losing. Finally, he stepped aside. "You have 2 minutes." Kira didn't waste time responding. She poured betadine over the insertion site, made a small incision between the 5th and 6th ribs, and used a curved clamp to tunnel through the muscle layers. Her movements were exact, no wasted motion, like she'd done this 100 times in worse conditions. She inserted the chest tube, felt the pop as it entered the pleural space, and connected it to the drainage system. Blood and air rushed out immediately. The patient's stats improved. Oxygen saturation climbed to 96. Blood pressure steadied at 110/70. Total time, 1 minute, 40 seconds. Gina, the scrub nurse from the appendectomy, was standing near the back. She whispered to Dante, "Jesus, I've never seen a resident move like that." Dante just nodded. Hale pulled off his gloves slowly. He looked at the monitor, then at Kira. "Where did you train?" he asked again. "I told you, here and there. That's not a real answer. It's the one you're getting." Anderson stepped between them. "Marcus, the patient's stable. That's what matters." Hale's jaw worked, but he didn't push further. He turned and left the room without another word. Kira stripped off her gloves, tossed them in the bin, and started charting. Her hands didn't shake. Her breathing was even. Dante moved beside her. "That was insane. It was necessary. You didn't even hesitate. Hesitation kills people." He studied her. "You sound like you know that from experience." She didn't answer. Anderson approached, arms still crossed. She didn't say anything at first, just watched Kira finish the chart note. Finally, she spoke. "I was an army nurse, 10 years, mostly stateside, but I did 1 rotation at Landstuhl." Kira's pen paused for half a second. "I've seen combat medics work," Anderson continued. "The way they move. The way they prioritize. You move like that." Kira looked up. "I'm just a resident." "No," Anderson said quietly. "You're not." They held each other's gaze. "I won't ask," Anderson said. "But if you ever want to talk, I'm around." She left before Kira could respond. Dante was still standing there. "She's right, isn't she?" Kira closed the chart. "I need to check on the gallbladder patient." "Kira, drop it, Dante." He watched her walk away, then looked at Gina. "She's hiding something." Gina nodded. "And whatever it is, it's bigger than this place." The patient's name was Ryan Cole, 26 years old, motorcycle enthusiast, no family in the area, just a girlfriend who arrived 30 minutes later, crying so hard she could barely speak. Kira met her in the waiting room. "He's stable," Kira said. "The chest tube is in. He's breathing on his own now. We're moving him to ICU for observation." The girlfriend, a small woman with blonde hair and smudged mascara, grabbed Kira's hand. "Thank you. Oh my God, thank you." Kira nodded. "He got lucky. They said you saved him, that you didn't even wait." "I did what anyone would do." "No," the girlfriend said, squeezing her hand tighter. "They said you did what no one else could." Kira gently pulled her hand back. "He's going to be okay. That's all that matters." She left before the conversation could go further. Back in the locker room, she sat alone, staring at her hands. They were clean now. Scrubbed twice, but she could still feel the weight of the catheter, the resistance of the tissue, the hiss of air that meant the difference between life and death. She'd felt that 100 times before, in Kandahar, in Helmand, in places that didn't have names, just grid coordinates. Her hands had saved lives in rooms where the ceiling shook and the lights went out, and the only thing that mattered was speed. But here, in this clean, bright hospital, those hands made her dangerous, because they revealed what she was trying to hide. She pulled her hair back and looked at her reflection in the locker mirror. The tattoo was visible now, the small tactical cross behind her right ear, a mark she couldn't erase, a past she couldn't outrun. She let her hair fall back down and stood. Her pager buzzed. Another patient, another chart, another chance to pretend she was just a first-year resident learning the ropes. But the pretending was getting harder. The alarms started at 4:37 p.m. on a Tuesday. Kira was in the physician's lounge, halfway through a sandwich she'd forgotten to eat for 6 hours, when the overhead speakers crackled to life. Trauma alert. Mass casualty incident. All available surgical staff report to ER immediately. Repeat. Mass casualty incident. She dropped the sandwich and ran. The ER was already chaos when she arrived. Nurses pulling crash carts, attendings shouting orders. Dante sprinting past with armfuls of IV bags. Dr. Anderson stood at the center, coordinating. Her voice cut through the noise. Construction site collapse. Downtown. Steel beam fell. 6 critical patients incoming. First ambulance arrives in 2 minutes. Hale appeared beside her, pulling on a trauma gown. How bad? Bad. Crush injuries, possible internal bleeding, at least 2 with compromised airways. We'll need all hands. Where's? He spotted Kira. Vaughn, you're taking the least critical. Triage Bay 3. Understood. Don't do anything stupid. She didn't respond. The first ambulance screamed into the bay. Paramedics unloaded a man in his 40s, unconscious, chest caved in. Hale took him. The second ambulance brought a woman, early 30s, femoral artery bleed. Anderson grabbed her. The third ambulance rolled in slower. The paramedic in back looked grim. 29-year-old male, crush injury to abdomen and pelvis. Vitals are holding, but he's deteriorating. BP 90/60, heart rate 110, GCS 14. They wheeled him into Bay 3. Kira stepped forward. The patient was conscious, eyes half open, face pale and slick with sweat. His work shirt was soaked with blood. His breathing was shallow, fast. She moved to his side. Sir, can you hear me? He nodded slightly. I'm Dr. Vaughn. We're going to take care of you. His lips moved. She leaned closer. Hurts, he whispered. I know. We'll get you pain meds. Can you tell me your name? Joel Reeves. She started her exam. Abdomen rigid. Bruising across the lower right quadrant. Pelvis unstable. Internal bleeding. No question. She called out to Dante. I need 2 large-bore IVs, O-neg blood, and a fast exam now. He moved fast, setting up the ultrasound machine while she got the lines in. The fast showed free fluid in the abdomen. Lots of it. He's bleeding internally, she said. He needs surgery. Hale's voice came from across the room. Stabilize him and get him in line. We've got 2 ahead of him. Kira checked the monitor. Blood pressure dropping. 85/55. He doesn't have time to wait. Then keep him alive until we're ready. She looked back at Joel. His eyes were still open but unfocused now. Shock was setting in. She squeezed his hand. Joel, stay with me. His fingers twitched. Then his eyes shifted, focused on her face, and something changed. He stared at her like he was trying to place a memory. Wait, he whispered. I know you. Kira's pulse kicked. You're confused. It's the shock. No. His breathing quickened. Those hands. The way you move. I've seen it before. Joel, you need to stay calm. Syria, he said. 2019. Ambush outside Al-Hasaka. My whole squad was hit. There was a medic, a surgeon. She pulled me out of a burning vehicle and operated on me in the dirt while rounds were still coming in. Kira's jaw locked. She had a tattoo, Joel continued, his voice barely audible, right behind her ear. Tactical cross. Dante, standing nearby, froze. Joel's hand reached up weakly, trembling, and touched the side of her head where her hair covered the mark. You're her, he whispered. You're Shadow 6. Kira didn't move, didn't confirm, didn't deny. Dante's eyes went wide. Before anyone could say another word, Joel's monitor started beeping. His blood pressure dropped to 70/40. He's crashing, Kira said. Hale appeared at the bay entrance. What's his status? Hypotensive, tachycardic, free fluid in abdomen. He needs an OR now. Hale looked at the monitor. OR2 is still occupied. 15 minutes. He doesn't have 15 minutes. Then buy him time, Dr. Vaughn. She looked down at Joel. His eyes were closing. His skin was gray. She'd seen this before, too many times. The moment when a body decides it's easier to stop than keep fighting. She leaned close to his ear. Joel, you're 75th Ranger, right? His eyes flickered. You didn't survive Al-Hasaka to die on a construction site in Seattle. Stay with me. That's an order. His lips move. Ved, a faint smile, but his pressure kept dropping. Kira turned to Hale. I can do this here, now. Excuse me? Exploratory laparotomy. I can control the bleeding and stabilize him until OR is free. Hale stared at her. You're a first-year resident. I've done this surgery over 100 times. Not in a civilian hospital, you haven't. The words hung in the air. Hale's expression shifted, realization dawning. Dante stepped back, putting pieces together. Anderson appeared in the doorway, blood on her gown, eyes sharp. She'd heard the whole exchange. Marcus, she said, let her work. She's not authorized. He's dying right now. You want to wait for authorization or you want to save him? Hale looked at Kira, at Joel, at the monitor showing a blood pressure that wouldn't last another 5 minutes. Who are you? He asked. Kira met his eyes. Someone who doesn't let people die because of paperwork. Joel's pressure hit 65/35. The monitor alarm screamed. Hale's hands clenched into fists, his pride fighting against the reality in front of him. Finally, he stepped aside. You have 3 minutes to stabilize him, he said. After that, we're moving him to OR whether you're done or not. Kira didn't wait for him to change his mind. Dante, I need a crash cart, laparotomy kit, and 4 units of ONEG. Gina, get me gloves and a gown. Someone call anesthesia. They moved. Hale stood at the edge of the bay, arms crossed, watching. Anderson stayed in the doorway, silent but present. Kira pulled on gloves, didn't bother with a full gown. No time. She prepped Joel's abdomen with betadine, grabbed a scalpel, and looked down at him one last time. His eyes were barely open. Joel, she said, I'm not losing you twice. She made the incision, and the room held its breath. If you've ever had to hide who you really are to fit in, subscribe and drop a comment below, because what happens next will change everything. Blood welled up from the incision, dark and fast. Kira's hands didn't hesitate. She placed clamps, called for suction, and extended the opening with controlled precision. Her movements were economical, instinctive, like she'd done this in her sleep. Lap pads, she said. Dante handed them over. She packed the abdomen, searching for the source. Liver laceration grade 3. Bleeding but not catastrophic. Splenic injury contained. The real problem was lower, near the iliac vessels. Retractor. Gina placed it in her hand. Kira pulled back tissue, exposed the bleeder, and clamped it in one motion. The monitor steadied. Blood pressure climbed to 75/45. Hale stepped closer, watching over her shoulder. His face was unreadable. You're not suturing that here, he said. I'm stabilizing it. You can close in the OR. This isn't protocol. Protocol doesn't stop people from bleeding out. She placed another clamp, checked for additional bleeding, and packed the abdomen with surgical sponges. Joel's pressure hit 85/50. He's stable enough to move, she said. Hale didn't argue. Get him to OR 2, now. The trauma team wheeled Joel out. Kira stripped off her gloves, her gown smeared with blood, and exhaled for the first time in 3 minutes. Dante stared at her. What the hell was that? She didn't answer. Hale grabbed her arm, not rough but firm. My office, now. Anderson followed. They walked through the crowded ER, past nurses cleaning blood off the floor, past residents whispering and staring. Kira kept her eyes forward. Hale's office was small, neat, filled with framed certifications, and a photo of his family on the desk. He closed the door and turned to face her. Sit, he said. I'd rather stand. That wasn't a request. She sat. Hale leaned against his desk. Arms crossed. Anderson stood near the door, silent but present. I've been doing this for 28 years, Hale said. I've trained over 100 residents. I know what first-year competency looks like. And you, Dr. Vaughn, are not a first-year resident. Kira said nothing. Your technique isn't textbook, your speed isn't normal, and that patient knew you. Called you by a name I've never heard. He waited. She didn't speak. So I'm going to ask you one more time. Who are you? Kira looked at him, then at Anderson. The room felt smaller than it was. I'm a doctor, she said. That's not an answer. It's the only one that matters. Hale's jaw tightened. I can pull your file. I can make calls. I will find out. Then do it. Or you could just tell me. She met his eyes. Why does it matter? Joel Reeds is alive. That's what you care about, isn't it? I care about my hospital. I care about liability. I care about residents who operate outside their scope and put my program at risk. I didn't put anyone at risk. I saved a life. You performed a procedure you're not authorized to do. I'm authorized to do whatever keeps someone from dying. Hale straightened. Not in my ER. Before Kira could respond, there was a knock on the door. Anderson opened it. A nurse stood outside, breathless. "Dr. Hale, Joel Reeves is crashing. They need you in OR 2. Hale's face went pale. He pushed past Kira and ran. Kira followed. The OR was chaos, alarms screaming, anesthesiologist barking out vitals. The attending surgeon, a man named Dr. Patel, stood over Joel with blood pooling faster than suction could clear it. "What happened?" Hale demanded. "Bleeder we missed," Patel said. "It's the inferior mesenteric. I can't get to it. Too much blood." Kira stepped to the table. "Let me see." Patel looked at Hale. Hale hesitated. Joel's pressure dropped to 60/30. "He's got maybe 2 minutes," the anesthesiologist said. Kira didn't wait for permission. She moved beside Patel, looked into the open abdomen, and saw the problem immediately. The vessel had retracted behind bowel, hard to reach without risking more damage. "I need a DeBakey clamp and a vascular tie," she said. Patel handed them over. Kira reached in, moved the bowel with her left hand, exposed the vessel, and clamped it in one smooth motion. Blood flow stopped. She tied off the vessel, double-checked for other bleeders, and stepped back. The monitor climbed. 70/40. Then 80/50. The room exhaled. Patel stared at her. "How did you do that so fast?" She didn't answer. Hale stood near the door, hands clenched, watching her like she was a puzzle he couldn't solve. Anderson stepped beside him. "You know what she is, Marcus." "I know what I think she is." "Then stop pretending you don't." Hale's eyes stayed on Kira. "If she is what I think, then why is she here? Why is she pretending to be a first year?" "Maybe because she's tired of being what everyone expected." Kira stripped off her gloves and walked out of the OR without a word. She made it to the locker room before Hale caught up. "Dr. Vaughn." She didn't turn around. "That patient in there just called you Shadow 6. That's a military call sign." She opened her locker, stared at the empty space inside. "I looked it up," Hale continued. "Shadow 6 was the call sign for a Delta Force combat surgeon, deployed to Afghanistan, Iraq, Syria. Over 600 field surgeries, decorated. Discharged 18 months ago." Kira's hands gripped the locker door. "That's you, isn't it?" She turned slowly. "Does it change anything?" "It changes everything." "Why? Because now you know I'm not some lucky first year who watched too many YouTube videos?" Hale stepped closer. "Because you lied. You came here under false pretenses." "I didn't lie. I'm a doctor. I have an MD. I completed all the requirements for residency. I just didn't list my previous experience." "That's a lie of omission. That's survival." The words hung between them. Hale's expression softened, just slightly. "What are you running from?" Kira looked away. "Nothing you'd understand. Try me." She was quiet for a long moment. When she spoke again, her voice was barely above a whisper. "I got tired of making decisions that killed people no matter what I chose. I got tired of operating in places where the ceiling shook and the lights went out, and the only thing that mattered was who you saved and who you let die." She looked back at him. "I wanted clean medicine, simple cases, appendectomies and gallbladders. I wanted to save lives without wondering if the person I saved would be the one who planted the bomb that killed my team the next day." Hale didn't speak. "So yes," she continued, "I didn't tell you I was Delta Force. Because the moment people know, they see the operator, not the doctor. They see the weapon, not the person. And I'm tired of being a weapon." Before Hale could respond, Anderson appeared in the doorway. "Joel Reeves is stable," she said. "He's asking for you." Kira closed her locker and walked past both of them. Joel was in recovery, intubated but conscious. His eyes found hers immediately. She stepped beside the bed. "You're going to be okay." He reached for her hand. His grip was weak but steady. She let him hold on. "Thank you," he mouthed. She nodded. "Thank the Rangers. They trained you not to quit." He smiled just barely and closed his eyes. Kira stood there for a moment longer, then gently pulled her hand away and left. In the hallway, Hale was waiting. "We need to talk about what happens next," he said. She looked at him. "What happens next is I go back to work." "It's not that simple." "Yes," she said, "it is." And she walked away. The call came 16 hours later. Kira had just finished a double shift, was halfway to the parking garage when her pager went off. "Trauma alert, all hands." She turned and ran back. The ER was packed. Every bay full. nurses moving like choreographed dancers through the chaos. The air smelled like antiseptic and adrenaline. Anderson was at the center again, coordinating. She saw Kira and pointed. Trauma 2. Now. Kira pushed through the doors. A man lay on the gurney, mid-30s, construction vest still on, face gray. His chest wasn't moving right. Flail chest, multiple rib fractures. But that wasn't the worst part. The worst part was the metal fragment embedded just left of his sternum, shrapnel. Kira's breath caught. She knew that pattern. She'd seen it 100 times. The jagged edges, the way it sat at an angle, the scatter marks on the surrounding tissue. Improvised explosive device, IED fragmentation, but this was Seattle, not Kandahar. What happened? She asked the paramedic. Gas line explosion at the construction site. This guy was closest. Fragment went in clean, but it's sitting right next to his heart. We didn't dare move it. Kira stepped closer, examined the wound. The fragment was maybe 2 inches long, irregular, lodged between the ribs. One wrong move and it would puncture the pericardium. Hale entered behind her. He looked at the patient, then at the shrapnel, and his face went pale. We need cardiothoracic, he said. Page Dr. Maida. He's in surgery, Anderson said from the doorway. Won't be free for 90 minutes. Hale checked the monitor, heart rate 130, blood pressure 95/60, holding, but barely. We stabilize and wait, Hale said. Kira shook her head. He doesn't have 90 minutes. That fragment shifts even a millimeter and he's gone. Then we keep him still. You can't keep a heart still, Dr. Hale. He turned to her. What are you suggesting? She looked at the shrapnel again, calculated the angle, the depth, the proximity to the coronary vessels. I can remove it, she said. The room went quiet. Hale stared at her. You want to perform a cardiac procedure in the ER? It's not a full procedure, it's a fragment extraction. I've done it 43 times. In a war zone. In worse conditions than this. This is not a war zone, Dr. Vaughn. Tell that to him. The patient's eyes fluttered open. He looked at Kira, terrified, barely able to breathe. Please, he whispered. Hale's jaw worked. He looked at Anderson. She nodded. Let her try. If this goes wrong, if we wait, Kira interrupted, he dies. If I try and fail, he dies. But if I try and succeed, he lives. Those are the only 3 options, and 2 of them require me to act. Hale was silent for a long moment. Finally, he stepped back. You have 1 chance. The second anything goes wrong, I'm taking over. Kira didn't waste time answering. I need a thoracotomy tray, suction, 20 proline sutures, and a crash cart on standby. Get me anesthesia for local block and sedation, and I need everyone to stop talking. The team moved. Dante appeared at her side, handed her gloves. His face was serious, no jokes this time. You got this? He asked quietly. She met his eyes. I don't have a choice. She pulled on the gloves, prepped the area around the fragment, and injected local anesthetic. The patient was sedated but semi-conscious, safer that way. She could monitor his responses. Sir, I need you to stay as still as possible, she said. I'm going to remove the metal. You'll feel pressure, but not pain. Breathe slow and steady. He nodded, eyes wide. She picked up forceps, positioned them around the fragment, and paused. This was the moment, the one where hesitation could kill. She thought of Helmand Province, the Marine with the rod through his chest, the ceiling shaking, the lights flickering. She'd pulled it out in the dark, by feel, with nothing but a headlamp and a prayer. This was cleaner, brighter, easier. She pulled. The fragment came free, smooth and controlled. Blood welled up immediately, but not fast. No arterial spray, no puncture. She dropped the fragment into a tray, placed gauze, applied pressure, and watched the monitor. Heart rate steady, blood pressure holding, no tamponade, no bleed. She sutured the entry wound in 4 stitches, dressed it, and stepped back. The patient gasped, then breathed easier. The room exhaled with him. Hale stood frozen, staring at the fragment in the tray. His hands were trembling slightly. How did you know the angle? He asked. Experience. That's not an answer. Kira pulled off her gloves. I've removed IED fragments from 67 soldiers. I know what they look like. I know how they sit. I know how they move. She looked at him, and for the first time, there was no deflection in her voice. I know because I was trained to know. Because I spent 8 years in places where this was normal, where shrapnel in a chest was Tuesday, where if you hesitated, people died. The ER had gone silent. Everyone was. Listening now. Hale's voice was quiet. Who are you? Kira straightened. Her shoulders squared. The posture she'd buried for 18 months came back like muscle memory. Major Kira Vaughn, she said. MD, United States Army Medical Corps. Delta Force, 1st Special Forces Operational Detachment Delta. 8 years active duty. 47 combat deployments. Over 600 field surgeries. 3 commendations for surgical excellence under fire. She paused. I left because I was tired of watching people die from decisions made by people who'd never seen a battlefield. I came here because I wanted to practice medicine without politics, without rank, without having to choose who lives based on mission priority. No one moved. Hale's face was unreadable, somewhere between awe and disbelief. Anderson stepped forward. She's telling the truth. I looked her up after the first surgery. Her record is classified. But the parts that aren't are extraordinary. Dante whispered, "Holy shit." Kira looked around the room, at the nurses, the residents, the attendings, all of them staring. She'd spent 18 months hiding, 18 months pretending, 18 months trying to be smaller than she was. And now it was over. I didn't come here to take anyone's job, she said. I came here to learn how to be a doctor again instead of a soldier. But if you need me to be what I was trained to be, then I will, because saving lives is the only thing I've ever been good at. The patient on the gurney reached for her hand. She took it. Thank you, he whispered. She nodded. You're welcome. Hale finally moved. He stepped closer, looked at her for a long moment, then extended his hand. Dr. Vaughn, he said, I owe you an apology. She shook his hand. You owe me nothing. You were protecting your program. I was protecting my pride, he corrected, and I was wrong. He glanced at Anderson, then back at Kira. We need to talk, he said, about what happens next. Kira pulled her hand back. What happens next is I finish my shift. That's not what I mean. She met his eyes. I know what you mean, and the answer is I don't know yet. Fair enough, Hale said. But when you figure it out, my door is open. He left. The ER slowly returned to motion. Nurses charting, residents whispering, Dante cleaning instruments, sneaking glances at Kira like she'd just grown wings. Anderson stayed behind. That took guts, she said. Kira didn't respond. You know they're going to treat you differently now. I know. Is that what you want? Kira looked at the patient, now stable, breathing easy, alive because she'd refused to let fear make the decision. I don't know what I want, she said, but I know what I am, and I'm done pretending I'm not. Anderson smiled. Good. She left Kira standing alone in the bay, surrounded by the machines and monitors and quiet hum of a hospital that had just learned who she really was. And for the first time in 18 months, Kira didn't feel like she was hiding. She felt like she could breathe. 2 days later, Kira was called to the hospital administrator's office. She'd expected this. The moment she revealed who she was, the bureaucracy would follow. Liability concerns, credential verification. Questions about why she hadn't disclosed her background. She walked through the pristine hallways of the administrative wing, past framed photos of hospital founders and plaques commemorating donors. Everything here was clean, controlled, far removed from the chaos 3 floors below. The administrator's name was Dr. Catherine Brennan, late 50s, sharp eyes, 20 years running the hospital's operations. She sat behind a wide desk, hands folded, expression unreadable. Hale was already there. So was Anderson. Dr. Vaughn, Brennan said. Please sit. Kira sat. Brennan opened a folder. I've spent the last 48 hours reviewing your file. Your medical degree is legitimate. Your residency application was accurate as far as it went. But you left out 8 years of surgical experience that would have qualified you for a senior attending position. I'm aware, Kira said. Why? Kira glanced at Hale, then back at Brennan. Because I didn't want to be hired for what I was. I wanted to be trained for what I could become. You're already one of the most experienced trauma surgeons in the country. I'm experienced in field medicine, not civilian protocols, not long-term patient care, not medicine without a mission clock. Brennan leaned back. Dr. Hale has informed me of your performance over the last 2 weeks. 3 complex cases, 3 lives saved, 0 complications. He also tells me you performed procedures outside the scope of a first-year resident. I did what was necessary. Necessary isn't always legal, Dr. Vaughn. The room went quiet. Brennan closed the faux. Elder, that said, the outcomes speak for themselves. And after consulting with our legal team and medical board, we've decided not to pursue disciplinary action. Kira's shoulders relaxed slightly. However, Brennan continued, we can't keep you in a first-year residency position. It's not appropriate for your skill level, and frankly, it's a waste of resources. Then what are you offering? Brennan looked at Hale. He leaned forward. A senior trauma attending position, full surgical privileges, autonomy over your cases, and the opportunity to design a new training program. Kira's eyes narrowed. What kind of program? Combat-based trauma protocols for civilian emergency medicine, Hale said. You've seen things most of us never will. You've operated in conditions we can't imagine. That knowledge shouldn't be wasted. You want me to train residents to think like soldiers. I want you to train them to think like you. Fast, precise, unshakable. Kira was silent. Anderson spoke for the first time. The survival rate for severe trauma patients in this hospital is 68%. Nationwide average is 65%. You could push that number higher. Or I could make mistakes that get people killed, Kira said quietly. You haven't yet. I have. The words came out sharp, harder than she intended. Everyone looked at her. She exhaled slowly. Helmand Province, 2022, my last deployment. We were extracting wounded from the firefight. I stabilized 3 Marines, called for evac, and waited. Her voice was steady, but her hands weren't. The helo was delayed. Command said 14 minutes. It took 28. By the time it arrived, all 3 were gone. I'd done everything right. Perfect technique. Perfect priority. But it didn't matter because the decision to delay wasn't mine. She looked at Hale. I left because I was tired of being perfect and still losing people. I wanted medicine where the only variable was skill, not politics. Hale nodded slowly. I understand. Do you? No, he admitted, but I respect it. Brennan spoke again. Dr. Vaughn, what happened in Helmand wasn't your failure. It was a system failure. The Marines didn't care about the distinction, but you should. Kira looked away. Brennan stood, walked to the window overlooking the city. I've run this hospital for 2 decades. I've seen brilliant doctors burn out because they blamed themselves for things outside their control. And I've seen mediocre doctors thrive because they understood the limits of their responsibility. She turned back. You can't control evac times. You can't control command decisions. But you can control what happens in your OR. And from what I've seen, when you're in control, people live. Kira didn't respond. We're offering you a position, Brennan said. Senior attending. Design your own protocols. Train the next generation. Stay in Seattle or consult nationally. Your choice. Full autonomy. And if I say no? Then you finish your residency as planned, and we'll pretend this conversation never happened. Kira looked at Hale. You're okay with this? I'm recommending it, he said. You're the best trauma surgeon I've ever seen. And I've been doing this long enough to know when my pride is getting in the way of good medicine. She almost smiled. Almost. I need time to think, she said. Brennan nodded. Take a week. But know this, the offer won't wait forever. Kira stood, shook Brennan's hand, and left. She didn't go back to the ER. Instead, she walked to the hospital chapel, a small quiet room on the 2nd floor that no one used except for bad news. She sat in the back row, stared at the plain wooden cross on the wall, and let herself feel the weight she'd been carrying for 18 months. 3 faces, 3 Marines, 3 people she'd saved just long enough to watch them die. She'd carried their names in her chest like shrapnel, unremoved, unmovable. But maybe Brennan was right. Maybe it wasn't her failure. Maybe it was time to stop carrying weight that was never hers to carry. The door opened. Anderson stepped inside, saw Kira, and hesitated. Can I sit? She asked. Kira nodded. Anderson sat beside her, didn't say anything for a long moment. Finally, she spoke. I looked up the Helmand incident. It's partially declassified now. Kira's jaw tightened. Those Marines died because the evac helo was rerouted to extract a high-value target. A politician's son, who got pinned down during a photo op. Kira closed her eyes. Command prioritized the extraction based on optics, not medical need, Anderson continued. You were never told. You were just told to wait. It doesn't change the outcome. No, but it changes the blame. Kira opened her eyes, looked at her. Why are you telling me this? Because you've been punishing yourself for a decision you didn't make. And because those Marines didn't die because you failed. They died because someone else valued politics over lives. The words settled into the silence like stones into water. Kira's hands unclenched. I spent 8 years saving people, she said quietly. and the 3 I couldn't save are the only ones I remember. That's not true. It feels true. Anderson nodded. I know, but Joel Reeves is alive because of you. So is Ryan Cole. So is the guy with the shrapnel. They'll remember. Their families will remember. That has to count for something. Kira didn't respond. They sat in silence for a while longer. Finally, Anderson stood. Take the job, Kira. Not because you owe anyone, but because you're too good to waste. She left. Kira stayed. She sat there until the light through the windows shifted, until the chapel grew dim, until the weight in her chest felt just a little bit lighter. Then she stood, walked out, and went back to work. 3 days later, she returned to Brennan's office. I'll take the position, she said, on 3 conditions. Brennan raised an eyebrow. Go on. 1. I designed the training program my way. No committee approvals, no bureaucratic delays. Agreed. 2. Any resident who trains under me does so voluntarily. I won't force my methods on people who don't want them. Fair. 3. I want Joel Reeves involved. He's 75th Ranger. He knows what combat medicine looks like from the other side. His perspective matters. Brennan smiled. Done. She extended her hand. Kira shook it. Welcome to the team, Dr. Vaughn, Brennan said. Let's save some lives. 4 months later, the simulation lab was packed. 20 residents sat in tiered seating, notebooks open, eyes fixed on the center of the room where a full-scale trauma mannequin lay on a gurney, hooked to monitors that beeped with programmed vitals. Kira stood beside it, hair pulled back, the small tactical cross tattoo now visible behind her right ear. She didn't hide it anymore. Scenario, she said, her voice calm but commanding. Multi-vehicle collision. Your patient is a 28-year-old male, unresponsive, GCS 6, significant blood loss, BP 70/40. You have no attending, no backup. It's you, 2 nurses, and 6 minutes before he's unsavable. She stepped back. What do you do? A first-year resident named Marcus raised his hand. Establish airway, get 2 large-bore IVs, start fluids, and wait for the attending. He'll be dead before the attending arrives. Next. A second-year named Leah spoke up. Intubate, start blood transfusion, and do a fast exam to locate the bleed. Better, but you're still too slow. In 6 minutes, thinking takes 3, and acting takes 3. You don't have time for both. Kira moved to the mannequin. You have to think while you act. Hands move before the brain finishes the sentence. She demonstrated, calling out each step as she performed it. Airway secured. IVs placed. Fast exam shows free fluid in the abdomen. That's internal bleeding. You don't have time for imaging. You crack the chest or open the abdomen right here. The residents stared. In the field, we didn't wait for perfect conditions, Kira continued. We made the conditions work. You can do the same here. It's not about being reckless. It's about being decisive. She stepped back. Your hesitation is someone's death. Your confidence is someone's life. Choose which one you want to carry. The room was silent. Then Marcus spoke. How you learn not to hesitate. Kira met his eyes. You practice until hesitation isn't an option, and you accept that even when you do everything right, sometimes people still die. That's not failure. That's medicine. After the session, residents gathered around her, asking questions, taking notes. Kira answered each one with patience she didn't know she still had. Dante appeared at the door, leaning against the frame with his usual grin. You're like a celebrity now. It's weird. Kira smiled slightly. I'm still the same person. No, you're not. You're better. She didn't argue. Joel Reeves walked in, moving slowly but steady. He'd recovered fully, returned to light duty at his construction job, and started volunteering at the hospital twice a week. He helped run the combat trauma simulations, shared his perspective as someone who'd been on the receiving end of battlefield medicine. Dr. Vaughn, he said, we've got another scenario ready if you are. Let's do it. The next 4 hours were intense. Simulated mass casualty events, triage decisions, ethical dilemmas. Residents made mistakes, learned from them, and tried again. By the end, they were exhausted but sharper. Kira dismissed them, cleaned up the lab, and sat down for the first time all day. Hale walked in, holding a folder. Thought you'd want to see this, he said, handing it over. INSEE. D were statistics. Trauma survival rates at St. Catherine's had climbed from 68% to 79% in 4 months. Nationwide, hospitals were asking for Kira's protocols. The Department of Defense had reached out twice. You're making a difference, Hale said. Kira closed the folder. We're making a difference. Don't deflect. This is your work. She looked at him. It's our work. You gave me the space to do it. Hale nodded. Fair enough. He sat beside her. I got a call yesterday. FEMA wants you to design a national training curriculum for disaster response. They're offering full funding, travel, and a team. Kira raised an eyebrow. What did you tell them? That I'd ask you. She was quiet for a moment. What do you think I should do? I think you should do whatever lets you sleep at night. She smiled. That's not an answer. It's the only one I have. They sat in silence. Finally, Kira spoke. I'll consult, but I'm staying here. This is where I need to be. Hale nodded. Good, because I'm not ready to lose you yet. He stood, paused at the door. You know, when you first walked in here, I thought you were just another resident trying to prove something. And now? Now I know you were trying to survive something. He looked back at her. I'm glad you did. He left. Kira sat alone in the empty lab, surrounded by mannequins and monitors, and the quiet hum of machines that had no heartbeat. But somewhere 3 floors down, real hearts were beating. Real patients were breathing. Real lives were continuing, because she'd refused to let fear decide who she was. Her pager buzzed. Trauma alert. Multi-vehicle collision. All available staff to the ER. She stood, tied her hair back, and the tattoo caught the light. A mark she no longer hid. A past she no longer ran from. She walked out of the lab and headed toward the ER, where chaos waited and lives hung in the balance and decisions had to be made in seconds. This was her place. Not because she was a soldier. Not because she was Delta Force. But because she was a doctor who'd learned that hesitation kills and action saves, and the only failure is giving up. The ER doors opened. Dante saw her coming and grinned. Here we go. Kira pulled on gloves. Let's get to work. The first gurney rolled in. A young woman, unconscious, severe head trauma. Kira assessed her in seconds, called out orders, and moved with the calm precision of someone who'd done this 1,000 times in worse conditions. Around her, the team worked in sync. Residents she'd trained. Nurses who trusted her. Attendings who respected her. The woman's vitals stabilized. Another patient arrived, then another. The night stretched long, but Kira didn't falter. Because this was what she was built for. Not war, not missions, not politics or rank or call signs, just medicine. Clean, human, real. Hours later, when the last patient was stable and the ER finally quieted, Kira stood at the sink, scrubbing her hands, watching the water run clear. Anderson appeared beside her. You okay? Kira nodded. Yeah, I am. Good. They stood in silence for a moment. Then Anderson smiled. You know, when you first got here, I thought you were running from something. I was. And now? Kira looked at her reflection in the mirror. The scar on her jaw. The tattoo behind her ear. The face of someone who'd survived things most people couldn't imagine. Now she said quietly, I'm running towards something. Anderson nodded. That's all any of us can do. She left. Kira dried her hands, walked out into the hallway, and saw Joel waiting near the exit. He had a small photo in his hand. Wanted to show you this before I left, he said, holding it up. It was a picture of him with his family. His wife, his 2 young daughters, all smiling at a park. My youngest turned 3 last week, he said. I got to be there because of you. Kira looked at the photo, then at him. You got to be there because you didn't give up. Neither did you. She smiled. No, I didn't. He handed her the photo. Keep it, reminder that what you do matters. She took it, held it for a moment, then tucked it into her pocket. Thank you, Joel. Thank you, Major. He left. Kira stood alone in the quiet hallway, the photo warm against her chest, and for the first time in 18 months, the weight she'd been carrying felt lighter. Not gone, but manageable. She walked toward the exit, past the glow of monitors, and the hum of ventilators, and the soft beeping of hearts that kept beating, because someone refused to let them stop. Outside, the sky was starting to lighten. Dawn breaking over the city. Kira stopped, looked up, and breathed. She was exactly where she was meant to be. Not hiding. Not running. Just living. And saving lives, one heartbeat at a time. The end.